And welcome back to the show. EmblemHealth is one of the nation's largest not-for-profit health insurers, and they released its findings in a national survey of what value-based care means to patients as well as consumers. Now, the national study found only 1 in 4 consumers are aware of the term value-based care, and the results are a call to action for healthcare professionals and policy leaders. Joining us now to share more details is the Chief Medical Officer at AdvantageCare, physician, Dr. Navarra Rodriguez. And Dr. Rodriguez, good to have you.
Thank you. Thank you, Darren. And hello to everyone and all of the viewers. I'm proud to be here as President and Chief Medical Officer of AdvantageCare Physicians, which is part of the EmblemHealth family of companies. I do think it's very important for patients, consumers, to understand a little bit more about value-based care, why there's so much emphasis on it now, and what it means to them overall. I'm a primary care provider. I practice in Washington Heights. And so I think it's critical for our communities to understand how to get better value, better care, and do that in partnership with their providers.
So give me this now, because you have the term value-based care, and I said it from the intro. A lot of people don't even know what value-based care is. So what is the definition of value-based care?
Well, I like to think about it as being able to deliver high quality care and deliver great outcomes to patients and populations and communities in a cost-effective way. So that by following clinical guidelines, by understanding cost of treatments and impact of treatments, we can make better choices and better decisions together with patients to ensure that there are healthier outcomes. This ties back to being able to educate patients about conditions and treatments, to detect conditions like diabetes early, to intervene early with some conditions, and then to be able to deliver cost-effective treatments in order to manage chronic conditions and make sure that there are healthier outcomes. For example, a diabetic, being able to screen for high blood sugars early on in a patient's condition is important. To be able to deliver and prescribe cost-effective medications to manage that diabetes can then help prevent bad outcomes like blindness or kidney failure leading to dialysis, or vascular disease that can lead to amputations, costly treatments overall, and poorer outcomes for patients. By being able to focus on value and quality upfront in partnership with patients, we can ensure those outcomes are better so that patients have healthier, more productive lives.
And when we talk about the importance of value-based care, obviously better outcomes are there, and that's one of the main things, but also cost containment. So when we talk about cost containment, how does that work?
Yeah, we hear quite often how expensive our healthcare system is. And we know that based on best practices, there are cost-effective ways to manage conditions. For example, if a patient needs a medication for hypertension, there could be a brand name medication or a generic one that work effectively and equally as well. But for a patient to take the generic, it may mean a lower copay at the pharmacy and may mean better adherence to that medication as opposed to the brand name. So thinking about the cost of care and making good financial choices so that there's less burden to a patient, but less burden to the healthcare system overall.
And so for people who want to find out more information and really about how to do this and how to be connected in this kind of way, what's the best option for them?
Well, I think it's important for patients to have conversations with their providers, to ask about cost of care and quality and protocols and best practices. Those are simple questions that patients will have. For example, at AdvantageCare Physicians, our gastroenterologists do screening colonoscopies in office because we follow strict guidelines and standards. We're accredited by national institutions to do this well. What many patients don't know is that it's as high quality and more cost effective to have that screening colonoscopy, screening for colon cancer, done in an office than a hospital-based setting. So for patients to ask questions to their providers about the cost of treatment, treatment options, and how to be able to think about healthcare prevention and screening more productively will help us deliver value-based care more effectively.
And so I know part of the conversation is talking about moving from volume to actually value. So how do you make that happen?
Well, you have to have alignment between payers or insurance companies and providers of healthcare. So hospitals, doctors, and nurse practitioners, and other healthcare service providers. They have to be aligned in agreement that delivering better healthcare outcomes can overall reduce healthcare costs down the line. So focusing on early prevention and intervention and treatment can prevent costly treatments later on and ultimately deliver those better outcomes. So for doctors to have value-based agreements and arrangements with insurance companies like EmblemHealth, which is forward thinking in terms of value-based care, we can make sure that doctors, providers are working with those insurance companies or with the Centers for Medicare and Medicaid to effectively deliver high quality care to our patient bases, but also keep those individuals and communities healthier.
Yeah. And so we talked a little bit more about the consumer, really having a conversation with the provider. But let's be honest. I mean, just navigating this whole healthcare system is, for some people, it's like going through the encyclopedia. It's just really rough. You just don't know. So what are some of the best ways that really consumers can really bridge that gap with providers to get to the place of having this best value-based care?
Well, I think it is a difficult system to navigate, but being open and asking questions is very important. So, as patients come to Advantage Care physicians, we welcome questions about cost of care, cost of medications, about having a care plan that incorporates how to look at best outcomes and cost effectiveness and best quality, and to have those honest conversations and so that patients know what their options are and what that financial and quality impact may be. It's a good telling sign when a provider talks to patients about prevention quite a bit so that those patients know that provider is really thinking about ensuring that that patient has good outcomes. When providers talk about medication adherence and cost of medication and encourage paths and care plans that are cost effective and high quality, and will speak about best practices, those are also telling signs that that provider or that individual is focused on value-based care. But a simple question also, just ask your provider, your PCP, your specialist, what is value-based care and how can I make sure that I'm getting better quality and better outcomes?
Well, Dr. Rodriguez, I want to thank you so much for being with us and sharing with us. I think more people will get a little better insight into what value-based care means. And hopefully, as we talked about, they'll ask the right questions. So, Dr. Rodriguez, thank you so much for being with us here on Open.
Thank you.
All righty. We want our viewers to know if you want more information, always visit the website at emblemhealth.com. And there you can find out more about what we've just talked about. We've got more show. Encourage you, don't go anywhere. Open continues coming up right after this.